India has crossed the milestone of 1 billion COVID-19 vaccine doses administered. After a slow beginning in the middle of January, India's immunisation campaign has covered 3/4 of its 944 million adults with at least one dose, but only 31% with two at this time. The government wants all adults to be vaccinated this year.
India is celebrating the milestone of administering 1 billion COVID-19 vaccine doses with a song and dance. The government on Thursday promoted the achievement with musical and other programs across the country and special illuminations of national monuments, even as a recent drop in inoculations worries healthcare providers. Prime Minister Narendra Modi marked the occasion by meeting staff at a hospital in New Delhi.
आज 21 अक्टूबर
October 21st, 2021 has been scripted in history as India has crossed the 1 billion mark of administering COVID-19 vaccine doses.
100 करोड़ वैक्सीन डोज का आंकड़ा पार कर लिया है। 100 साल में आई
Now the country has a strong shield of 1 billion vaccine doses to fight the biggest pandemic in the last 100 years.
डोज का मजबूत सुरक्षा कवच है।
Rajesh Dare is a healthcare worker at a vaccination centre.
It's like a festival for us as 1 billion doses have been administered, and with the efforts of everyone, the pandemic has been controlled in Maharashtra and the entire country.
The World Health Organization, which relies heavily on India for supplies to its global vaccine sharing platform COVAX, congratulated the country for reaching the landmark. After a slow start in January, India's immunisation campaign has covered 3/4 of its 944 million adults with at least one dose, but only 31% have received both doses. Nearly 90% of the vaccines administered have come from the Serum Institute of India. It produces a licensed version of the AstraZeneca drug. The SII has more than tripled its capacity since April and can now produce 220 million vaccine doses a month. Ministry officials are urging people to get vaccinated fast, especially as the ongoing festival season of family gatherings and mass shopping raises the risk of a new wave of infections.
Well, for more on this story, we're now joined by Dr. Rajib Dasgupta, who's the chairperson at the Centre of Social Medicine and Community Health at the Jawaharlal Nehru University in India. Prof, thanks very much indeed for joining us. Always good to talk to you. And we've been chatting for quite a while on this COVID-19 story. And the last time we spoke was earlier in the year. And it wasn't a great story at that stage, even though the government was working hard. Things have changed quite a bit since then.
Hello, good evening, Peter, and to all your viewers. Yes, India faced the dreaded Delta-led surge or the second wave roughly between mid-April and mid-June. It brought in its wake significant mortality and a very large number of cases. But ever since then, backed by the vaccination program, it's a much more comfortable situation now. The current new cases is about 18,000 in the last 24 hours, and that's really very significant journey. And of course, as you very rightly said, and there's a report detailed, India crossed a cumulative 1 billion doses today.
How has India been able to do this? What did the authorities do right, do you think?
India, of course, has the advantage of being a very significant producer of vaccines. Particularly, as we know, the AstraZeneca vaccine manufactured in India by the Serum Institute of India, which has really been the workhorse, providing at any point of time about 90% of the vaccines daily. And even now, with 3 vaccines, including Covaxin and the Sputnik, It's still about 85–87% of the supply daily. So the vaccine market, production has been a very important factor. Also the fact that India's immunization program has steadily grown over the last 2 decades. And if we put the clock back to about 20 years, it's roughly between 2000 and 2002 when it was realized that the success of the polio eradication program is very strongly based on the fundamentals of the immunization program. It's been strengthened consistently in a sustained manner. And it's basically on those fundamentals that the COVID vaccination program was able to build upon.
Now, it's one thing to have vaccine doses available, and it's another to actually get them in people's arms. How do you think that the authorities have been able to get so many people to come forward and get vaccinated, where we're seeing around the world a lot of hesitancy?
Yes, it's true that in the initial stages, there was indeed some hesitancy, but the communication program, both at the federal level as well as at the state and district levels, have been able to tailor to the changing needs and the changing trends. Backed with the fact that across states, all institutions have led from the front, while in this particular case, the private sector was very liberally supplied with vaccines. But even then, in the aggregate, about 90% or 90% plus vaccinations have actually happened in the government sector, which indeed is a marker of very robust confidence in the government as far as the immunization program goes. But then I would again reiterate that it links back to our very strong fundamentals in this program.
So do you think that India is well past any concerns and fears of a significant wave in the future?
Yes, and that really is an interplay of largely two things. One, the substantial vaccine coverage, 70% of the population at least receiving 1 dose and nearly a third receiving 2 doses. Second, all the recent sero surveys have shown a very high level of seropositivity. In fact, the most recent sero survey coming from at least 2 states within the last week shows an overall seropositivity of about 80%, and even children in its various age bands have a seropositivity of between 50 to 60%. So these 2 factors together would certainly be protective for some time to come. Now, barring a new variant emerging, but that's being tracked by an increased strength of the genomic surveillance program, with more laboratories being brought under its network.
In reaching such a significant milestone, how has this translated into everyday life? Are people seemingly getting on with life as normal, inverted commas, economic activity starting to ramp up? What are you seeing?
Yes, life is near normal. The last of the 2 sectors to open up are education and entertainment. Entertainment sector is nearly open across all states, with, of course, restrictions of numbers, a set of do's and don'ts and advisories. The educational institutions have also begun to open up, though I wouldn't say near normal, but certainly in all states, they are opening up, and one expects, if things stay this way, perhaps by December or so, a lot more education institutions would open up. And it also means that the economy is recovering, but then it's recovering from a very huge loss that we sustained over months, and therefore economy coming back to normal, again under inverted commas, would certainly take time, but it's in the positive direction.
Have you started to see a lot of people traveling in and out of India in recent months?
Yes, domestic travel has certainly picked up. In fact, it's only in the last week that the government actually okayed 100% occupancy for domestic air travel, which had some quantitative restrictions. The international travel, of course, is more regulated depending on the country passengers are arriving from and the state of the pandemic in those countries, which is understandable. But even international traffic is also picking up, certainly, and it's a lot different from what it was even a few months ago.
Is a booster shot something that's being mooted in India?
Well, that's an emerging debate and conversation. At the federal level, the sense is that this is not a priority till the entire eligible population or currently eligible population is immunized with 2 doses, till the needs of children are addressed. But at least one state advisory committee has actually advised, though this is not a decision that's formally approved or taken, that booster dose needs to be considered for the elderly, for the immunocompromised, and particularly for the healthcare workers who are actually in contact with COVID patients. So this is an emerging conversation. The scientific community is also looking at the way the science around boosters is evolving, the experience of booster in other countries. But yes, it's an ongoing conversation, but equity and achieving 2 doses for the entire population is certainly what is of primary importance now.
So, at the beginning of the year, there was an ambitious target set, and a lot of people weren't sure if it could be reached. But now that we're in October and we've reached this 1 billion milestone, do you think the target of vaccinating all adults by the end of the year is attainable?
Well, those who handle the nuts and bolts of the program feel that it may miss the target by perhaps a few weeks, but that's not too much of a concern because of the very high seropositivity, and therefore much of the population being in a state of protection, so to say. However, it's also important to remember 2 things. One, that India is a country with a very large number of partially immunized individuals now, and that in itself is a potential risk. And secondly, there are states, I mean, this 1 billion dose is the big picture, but there are states which are predominantly rural. That's lagging to some extent, certainly in terms of coverage with 2 doses of vaccine. So there's a differential across the states, and it's those states which really need to catch up now, and certainly will need to remain vigilant as far as the disease goes among those partially immunized, or even the 20-25% of the population who are not immunized at all.